Hello, my name is Dr. Kary Karahadian. I practice in Fresno. I've been treating patients with snoring and sleep apnea for 16 years here in our office, Fresno Snoring and Sleep Therapy, and I'd like to take a very brief moment and describe the problem of snoring and sleep apnea and its health concerns that go along with that, and then we'll talk very quickly about treatment. So if I can draw your attention to this first drawing. Here is a drawing of somebody who snores and has sleep apnea. And the pink area right here is our tongue, and the tongue is intimately connected to the lower jaw. When we fall asleep, the muscles of our neck and throat relax and our jaw relax, and the jaw falls back and the tongue falls back with it and compresses down the airway. And so as we're struggling to get air in through our nose or our mouth, the tissue back here rattles, creating the snore. And when it blocks completely, now the patient's not able to breathe at all because of this blockage. So that's where the whole problem with obstructive sleep apnea and snoring is derived. Treatment, there are two standard treatments. There are two boxes. I'll go quickly over them. There should be a third box in this, a third drawing, and that should be weight loss, because we know that if there's one thing that predisposes people to sleep apnea and snoring, it's excessive weight gain. But in terms of treatment, there is a device called the CPAP, which is the gold standard treatment, and it's a mask that fits on the patient's face. And it's not breathing for the patient, it's a fan, and it blows air in and increases the air pressure in the back of the throat, and that excess pressure lifts the tongue up. If you turn the fan off, the tongue falls back down again. Turn the fan back on and the tongue raises up. And once the tongue is up, then the patient breathes on their own through the windpipe, which was opened up by the fan. The other treatment, and this is the therapy that I provide, is an oral device, not unlike retainers, that the patient wears at night, and it passively holds the jaw in an up forward position, doing essentially the same thing, lifting the tongue up so the patient then breathes through their own. Why do you want to treat this problem? Well, people that have sleep apnea are at greater risk for stroke, heart attack, adult onset diabetes, acid reflux, hypertension, high cholesterol, hearing loss. There are all sorts of issues that go along with untreated sleep apnea. It's an enormous health problem, and treating it really improves a person's quality of life. My preference, when possible, is to treat a patient with an oral appliance, simply because compliance with CPAP is only, in the best studies, about 50%. So of the patients that are given CPAP, about half of them after the third year are not using their CPAP any longer. We have much, much higher compliance with oral appliances. Patients feel that they sleep better because they're not tethered to the aqua lung, if you will. For patients with very severe sleep apnea, we always want them to try CPAP first. So oral appliances, although great, are not a solution for everybody. You have to choose your patients properly.